Overall, from a high level, we continue to see several months now of sustained improvement with COVID hospitalizations and an increase in the supply and availability of the vaccine. And by that I mean the doses we are receiving are considerable. We have more enrolled providers than ever around the state to actually administer the vaccine. I think that number is actually over 1,500 now. And I think you're going to see that there are, over the last couple of weeks, from some small increases in the incidence of COVID in Louisiana, which concerns me and should concern all of us, especially when you put it into the context of the variants that are out there. Our baseline numbers, however, continue to be low, and in the grand scheme of things, relatively flat, as you'll see shortly. And we've made decisions in the past on very high baseline numbers as a reason to keep restrictions and mitigation measures in place, even if we had a couple of weeks where the trajectory had been improving. And so with basically flat or small increases with the very low and stable baselines, I've decided that we are going to take some steps in further reducing restrictions and mandatory mitigation measures. Another positive trend is the very steep decline in COVID deaths of people 75 and older, our most vaccinated group. And it's now been more than a month since Louisiana opened up vaccine eligibility to everyone 16 and older, regardless of occupation, regardless of any underlying health condition. We were one of the first states to do that. Today I can report 26% of Louisianans are fully vaccinated, and that includes more than 67% of those who are 65 and older. Now, on the one hand, we're very thankful that that number of people have chosen to be vaccinated. On the other, I can tell you that's not where we need to be, and we're going to have to continue to work hard to increase those numbers. But it is a good start, especially for our older and more vulnerable populations. So taking all this into account, we're going to be making some changes to the proclamation. I signed it a few minutes ago. It goes into effect tomorrow, and it'll be in effect for 28 days. Instead of a blanket mask mandate, we'll be allowing local leaders and business owners to set their own policies regarding masks. And of course, that's not any real change in the law. Private property owners always get to do things like that that are more restrictive, and certainly local political leaders have always had the ability to be more restrictive as well. I will tell you that because of a federal mandate, that masks are still going to be required across the state of Louisiana on public transit. It will still be required in many state buildings and at K through 12 schools in consultation with Superintendent Brumley and others in K through 12 education, and colleges and universities, and then all healthcare facilities licensed by LDH, because you certainly have a preponderance or a large number of individuals in those settings who are vulnerable to the disease based on their age and or health condition. And that does include nursing homes, which I think everybody can agree, especially since it was early in the pandemic, 40% of all deaths were happening in nursing homes. But I will tell you, I am very heartened at the improvements that we have made in nursing homes, and I think you're going to see some slides in a little bit from Dr. Kenner that will illustrate that. For state buildings, the mask mandate will stay in place. However, the head of an agency may opt out in writing to the Secretary of the Department of Health and just put a clear sign up at the doors that they have opted out. Now, even if they were to opt out, obviously people have the ability to wear a mask inside that building should they choose to do so, and I would recommend that they do that. All of my cabinet agencies will be keeping mask mandates in their buildings. It was just yesterday that I received a report of a DCFS worker who actually died from COVID, and so we're gonna keep the mask mandate in buildings that are controlled by state agencies that work for me. We know that masks work. The evidence is clear. The science is well established now, and we've seen a very positive impact on our state. But at the same time, we've had a mask mandate in place since the middle of July of last year. I think it's now intuitive for people to wear a mask in order to protect themselves in higher risk settings and also to protect others. And you may remember that early on, when masks were first recommended, it was all about protecting others. And then they realized that there's actually a benefit to the wearer of the mask because they achieve some protections from the virus as well. Fortunately, we have a lot more tools for slowing the spread of COVID than we and the controlling the impact of COVID as well than we did even a few months ago. And these include better treatments and, most importantly, several highly safe and effective vaccines. The three, Pfizer, Moderna, and Johnson & Johnson, all of which are available today in Louisiana. And again, anyone 16 and older is eligible to receive a vaccine. And just like other states that have lifted the mask mandates, it's not an end to mask wearing. It's not an end to recommendations that people wear masks, especially if they are vulnerable, if they're unvaccinated, or if they live with people who are vulnerable and unvaccinated. But I think it is a reflection of where we are at this stage of the pandemic. And I saw something the other day, Dr. Canner showed it to me, and I wanted to relate it to the public, all the people of Louisiana, that if it's a rule of thumb to try to determine in a particular situation whether you are relatively safe. And when in doubt, first thing you ask is everyone around me vaccinated? And you may or may not know the answer to that question, and there's a good chance you won't know. So then if you don't know or you're unsure, use the 2 out of 3 rule in order to slow the spread and make sure that you are as safe as you can be. Make sure your activities meets 2 of the 3 following conditions: outdoors, distanced, or masked. And if you're outdoors and you're distanced, you don't need to wear a mask. But if one of those 2 things isn't present, then, and you want to be safe, you need to wear a mask. I also ask all Louisianans to make sure that they are considerate of businesses and other settings where the owners or maybe a corporate policy or whatever will require that that particular business still have a mask mandate in place. I will tell you that I will continue to wear a mask when in public, when I am close to folks and I don't know that they've all been vaccinated and so forth. I think it's the right thing to do for public health. It's also the respectful thing to do. And am I vaccinated? Yes, I am fully vaccinated. But Dr. Canner briefs on breakthrough cases all the time. And there is no guarantee that I or anybody else fully vaccinated won't contract the disease or become contagious. And so especially if I'm around people who are not vaccinated, I will, and in small groups, then I will feel the need to continue to wear a mask. The new proclamation also eases some restrictions on live music, allows some businesses like salons to reopen their waiting rooms and waiting areas, and removes outdoor limitations on crowds. Indoors, event centers, theaters, conference facilities, they will be able to choose between a 75% occupancy capacity, which is more than they've had up to any point this far, while social distancing, or they can choose 100% capacity with masks and with a mask mandate in place. For all indoor sporting events, capacity is limited to 75% similarly with social distancing, or the individuals in charge of that venue can go to 100% if they want to have a mask mandate. For live music, new regulations will require 10 feet of space between the stage and the audience. And so that will obviously become something that is more readily available. I want to point out that social distancing, masking are still recommended by both the state of Louisiana and by the CDC. And there were a number of bills, if you will recall, that were passed by the legislature last year that I signed into law that confer liability protections to K through 12 schools, businesses, and so forth with respect to claims about individuals contracting COVID in those locations. But those protections are only available if the school, the business, and so forth is following CDC recommendations. There's nothing in the mask mandate that changes that law. And so businesses need to understand, schools need to understand, if you want to enjoy those protections from liability, you need to continue to adhere to those CDC recommendations. Before I invite Joe up, I do want to go through today's numbers. We are reporting 433 new cases of COVID on 23,545 new tests. It's a one-day snapshot, and the percent positivity in any given day really doesn't mean anything, but when you look at it in the context of other days, it can start to tell you something, but that's a 1.8% positivity percentage for the cases that are being reported today. The tests reported in the month of April is right at 462,000, not as high as we were previously, especially in the months of December and January and so forth, but it's still a robust amount of testing, especially relative to other states neighboring us, and well in excess of the amount of tests that we need in order to have a clear idea of what's happening around the state, especially when you look at that percent positivity. I did want to point out on this chart that you can see that Louisiana is now number 30 in the country on confirmed cases per capita. If you will remember, back in the immediate aftermath of the pandemic starting, Louisiana was number 1 for a long time. And so I want to thank the people of Louisiana. I want to thank all of our experts and the folks at the Department of Health and all of the medical providers and so forth, because with the work that we've done since then, we've actually moved from number 1 to number 30 among the 50 states and the District of Columbia. And that was certainly not easy to do, but it's an indication of the degree to which we've been able to more or less manage our response to COVID-19 up to now. And I do want to point out too that there's no guarantee that our state or any other state or as a country that we don't go backwards. And that is especially true if we don't get our vaccination numbers up. You can see some other states that are not doing as well as we are. There's certainly other countries in the world that are not doing as well as we are. Look to Brazil, look to India, for example. But I am confident that the steps we are taking today are the right things to do. Sadly, we are reporting 10 additional deaths today, and we're at a total now of 10,352. There are 308 individuals hospitalized. That's down 11 from yesterday. 46 of those are on mechanical ventilators, and that's down 1 from yesterday's report. So I'm going to turn it over to Dr. Canner now. He'll come up and go over some more information with you all as normal. I would ask that if you have questions for Dr. Cantor, ask those of him before he leaves the podium, and then once he leaves, I'll come back up, wrap up the press conference, and take your questions. Thank you.
Good afternoon. Thank you, Governor, on behalf of the Department of Health and Secretary Phillips, and thank you for your leadership. Now and throughout this ordeal, it's been about 13 and a half months since we had our first case of COVID diagnosed in Louisiana. And thankfully, we are in a much different place than we were back then. The overarching trend of the data that I'm going to present to you in a moment is that as an absolute number, the amount of COVID circulating in Louisiana is considerably less than it was. And that makes for a safer environment. Low risk or lower risk does not mean no risk. And that is why, while the mandate of masking is being removed in a number of settings, the public health recommendation of masking very much remains. And I'm going to talk a little bit more about how and why that is. Next slide, please. Every time that we advise the governor on a renewed proclamation, we present the epidemiologic data that we track in the Department of Health. And what we see really across all the measures that we look at is historic lows throughout the 13 and a half months that we've been responding to and sacrificing because of the COVID pandemic. I'm going to walk through some of that data right now. On the top left, you'll see a graph that represents COVID-like illness. This is the percent of all emergency department visits that are attributable to COVID-like symptoms. This is analogous to how we track flu, influenza every year. And we peaked right around Christmas and New Year's, have declined steadily since then, and now have been relatively flat for the past 5 or 6 weeks. On the top left, you'll see incidence, which is the number of new cases diagnosed, or people that test positive, unique people that test positive, unduplicated, every day rolled over a 7-day rolling average. You can see the 3 spikes that we had in Louisiana, the initial spike in March and April, the summer surge in July and August, the very, very large Christmas, New Year's spike, and then sustained progress since then to a very low baseline level in Louisiana. We have seen the beginnings of a little bit of an uptick over the past week or so, but overall that level, the amount of COVID out there, the amount of COVID being diagnosed every day is at a very low point for the state of Louisiana. We are currently counting 64 cases of COVID per 100,000 residents over a 7-day period. The CDC marks as high anything above 100. We're at 64 over 100,000. On the bottom left, you'll see a compound graph that I'm going to walk through. The bars, the bar graph, the orange bars on the bottom represent percent positivity, or the percent of all tests or all cases that are found positive. Last week, we reported our result to be 3.5%. As of now, and this will be reflected in the dashboard update tomorrow at noon, we are down to 2.8% positivity, which is a very, very low number, a historic low number for Louisiana. On that same graph, the purple line on top is testing volume. At the moment, we are ranking at 149 tests per 10,000 residents over a 7-day period. In March, as the governor mentioned, we had 527,000 tests conducted. On April to date, we've reported 462,000 tests conducted. You can see the testing volume has gone down noticeably since that surge in Christmas and New Year's. One of the things about testing is that more cases typically beget more testing. When you have more cases out there, you have more exposures, more reason for other people to get tested. People have symptoms more, it's being transmitted, and more people get tested. So we typically do see testing volume decline as cases, as transmission goes down as well. if you look around regionally, we think we're doing a good job with testing. Really, the point of this is to have enough visibility, to have confidence in these numbers and these projections. When you don't do enough testing, you can't trust your data that much. You feel like you're somewhat blinded. We are doing a significant amount of testing in Louisiana, and that gives confidence to the conclusions that we can draw from this data. Probably most notably is the bottom right graph, which is the number of hospitalized COVID patients at any given point in time in hospitals throughout Louisiana. Currently, we went down today 11 hospitalized patients to 308. That's almost a new low for us. I think we've got close to or just broke 300 a couple weeks ago. But just at that Christmas and New Year's surge, that peak all the way on the right side of that graph, we hit a high for Louisiana of 2,035 hospitalized patients across the state. And we have gone down precipitously and steadily since then to 308. This is as a result of two things, really. Number one, transmission has gone down across the state. Number two, vaccinations have gone up, particularly vaccinations of people who are vulnerable, likely to be hospitalized, have gone up. That's a very reassuring number to get our hospitalizations down steadily to a number like 308. The governor had mentioned some rankings compared to other states. We get weekly reports from the White House that gives data for Louisiana and also compares us to other states across the country. I want to run through a couple rankings with you right now based on the latest White House weekly report. We are 13th lowest in the nation for new cases day on day. We are 11th lowest in the nation for percent positivity, and that's with doing a decent amount of testing too. We are 6th lowest in the nation for hospitalizations. I think the people of Louisiana have done a good job controlling the spread of COVID. It's been the result of a lot of hard work, a lot of sacrifices, but we have gotten to a place that is much better than where we were, certainly this time last year. The other thing that's particularly changed from this point last year is we now have the strongest possible tool to protect ourselves and protect our families, and that's the 3 vaccines that the governor mentioned, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. For the bulk of this pandemic, we did not have those, and we were all vulnerable and susceptible. We have these tools now, and that is an absolute gift. It is the hope, the goal, and the driving aim of the Department of Health to encourage more people in Louisiana to avail themselves of those tools. Make no mistake, we have the tools now to protect ourselves and protect our families. And the reason why we can say that is because, without a shred of doubt, vaccines work. Evidence is mounting. The strongest evidence now actually comes from the nation of Israel and looking at how they've really driven transmission into the ground through mass vaccination. Vaccinations work, they drive down transmission, and they make people safer. That is not any more clear than it has been in nursing homes across Louisiana. Next slide, please. If you look at the nursing home graph over here, these are a number of new cases diagnosed in nursing homes over time. And we've marked out when the vaccination clinics were offered in nursing homes across the state. And you can see really from the beginning of the vaccination campaign in nursing homes, the number of new cases diagnosed has gone down considerably. For the past 8 weeks, we have been in the low double digits, between 10, 20, maybe 25 cases a week diagnosed in nursing homes. That's down from hundreds earlier in the pandemic. And we know the lion's share of mortality is in this type of area. This graph right here, again, as the governor mentioned, offers extraordinarily compelling proof of how well these vaccines work, and not in any setting. This is the highest risk setting there is. Vulnerable, elderly individuals in a close congregate setting where viruses of any nature can spread quickly. And look at all the progress that has been made as a result of the vaccine campaign. Next slide, please. We're also encouraged by the number of deaths and the decrease in the deaths reported day on day. Now, make no mistake, and this goes back to what I said earlier, lower risk does not mean no risk. And we still have, unfortunately, people dying from COVID. And today the governor reported 10. We'll likely report more next time that we talk. But the number of deaths, as you can see, has dropped considerably since about the New Year's and since we've been able to ramp up the vaccination campaign. It's most pronounced in elderly individuals. Next slide, please. And what you see here is two lines. The gray line is individuals aged 60 to 69. The purple line is individuals aged 70 and above, the number of deaths that they have day on day. And again, you can see since the beginning of the new year, since the vaccine campaign really picked up, fatalities from COVID in elderly individuals have dropped off considerably. These vaccines work. These vaccines work, and they don't just work for people in nursing homes. They work for everyone who takes the shot. Next slide, please.